speak to you guys. As Dr. Park said, I am in Orlando, Florida, so it's around 8 o'clock in the morning here, and it's on a Saturday, so it's a weekend. Usually we take it a little easier on Saturday mornings, but I couldn't pass up a chance to be with everybody today. I am an oral and maxillofacial radiologist, so I'm not an orthodontist, but I do have an interest in what you do. I have an interest in the craniofacial complex and how it works together, the TMJs, the airways, the occlusion, the cervical spine, the muscles, the soft tissues, the hard tissues, all that comes together in such an intricate balance. So I'd like to share with you one of these relationships, and that is the relationship between the TMJ and the occlusion, okay, which is basically what this talk is about. And of course, there are some changes that I'm going to show that occur to the occlusion due to an airway issue or due to a skull base issue. But the majority of today's talk is going to be about the TMJ and its relationships to the occlusion, or rather to changes in the occlusion, okay? So your patient might come to you, it may be a new patient who's seen somebody else or has never been seen before, or maybe your own patient 20 years later says, hey doc, now I have a gap between my teeth. My teeth fit perfectly before, and now I have a gap between my teeth, and what's going on? And so it's like a mystery that you have to solve. And there are a lot of clues in the craniofacial complex, but you have to know what you're looking for, the possibilities of the etiologies that may cause these bite changes. Okay, so I'm going to give you some more tools today. Most of my material is radiographic because that's where I come from. That's my area of specialty. But you can easily apply this to the changes in your patient's facial form clinically. And as I also, I've not mentioned this, but most of my imaging is cone beam CT. But there are things that you can see on panoramic and CEPHs, 2D CEPHs, that you can also apply from the increased biomechanical loading may be due to that asymmetrical head posturing due to the position of the spheno-occipital synchondrosis. Anyway, I'm done. All right. We talked about all this good stuff. I hope that I've opened up your eyes to some of the etiologies of bite changes. Some of them, they are in our world as dentists, but some of them may be somewhere else, and that we need to also be aware of these, and we need to also be able to diagnose them and send them for management. If we can't manage them ourselves, send them to be managed elsewhere. Here is my email. Okay, this is, if you're interested in learning more, I do give courses. I just gave a course here a couple of weeks ago, Understanding the TMJ and Airway, and that was 2 weeks ago, but I'm going to be doing it again in October, and here's one that's coming up on how to read cone beam CT. So it's a more comprehensive thing, and the information is on this website right here. Okay,